I'm Dr. Gerald Epstein, trained as a MD, psychiatrist, psychoanalyst, and then became an expert and a recognized authority in another dimension of working with the mind called mental imagery and imagination. I have a New York State Regents Chartered Training Center for all healthcare professionals to teach them this way. I've written 7 books, nearly 40 articles. I've been doing this work for 39 years, specifically in this area. And one of the books I've written is called Waking Dream Therapy, Unlocking the Secrets of Self Through Dreams and Imagination. I've conducted classes in group dream reading over the last 30 years, which has been quite fruitful and been transformative in people's lives. And I've developed a special way to transform your dreams, particularly if they are frightening or troublesome, difficult, and so on. Certainly you can look me up on my website, drjerryepstein.org, and you'll find a section in the website on dream reading. We don't interpret or analyze dreams, we read dreams, because the dream is your book of life. When a dream occurs, it is an informational compendium of you, but it's given to you in the natural and true language of the mind called image. So it's an inner language as opposed to this language I'm speaking to you in, which is called a discursive language, which is the verbal language with which we communicate back and forth. But there's a true and natural inner language that is the reverse of it, so to speak, which comes to us in this 3-dimensional form called image. The dream is a penetration of you into another world, because you turn your senses away from this external reality and your senses go inward to discover this other realm of existence called the dream. And the dreams then are presenting to us many pieces of information that we learn to read. It's a book of your life, and you're opening the book and reading it just as you would read any language, English, French, Spanish, Italian, whatever. You are learning to read this inner language, and this is what I teach. And I'm a recognized expert in the world, in the world of dreams and imagination, which are connected to each other intimately because they're image languages, and I'm a recognized authority in this field. And so the dream is giving us giving us information about our state of health, whether an illness is taking place or not. A man was riding on a horse in a dream. He fell off and he hit his head. I had him go for to be examined, have an X-ray, and he had a brain tumor. Another man found himself in front of a table in which there was a great layout, a splendid array of food, and he picked carrots to eat. So I had him introduce carrots into his diet, and it turned out there was a vitamin A deficiency, and he was having trouble with his eyesight. So this helped bring some repair to his eyesight because he introduced this food substance. It gives you information about, it answers questions that you may ask about your life. It will tell you an analogy to your everyday life experience, because the inside and the outside are reflecting each other, and you're looking into the mirror of your inside life, and it's reflecting you to you. And it'll come out in a 3-dimensional image, in a 3-dimensional form called an image. And you're seeing qualities of yourself reflected in these images. Qualities. So for instance, suppose you dreamt about a beaver. And so the beaver has the quality of industriousness. So it's speaking to a quality in yourself about that, which either you find yourself lagging in or utilizing to your benefit, or going too overboard with it. So we can discover what that is very quickly. The dreams give us immediate understanding of your life. And so it shows us the qualities and the analogy to your everyday life, so we can see the relationships that are going on, and it gives us answers to that. And it tells us what's coming. It tells us about what you may do to bring health to your life. It tells us maybe the onset of something coming into your life that you want to explore. And it also tells you about your how it gauges your healing process in yourself, and so on. Many other things it tells. So in the nightmare, what we do in this work is we go back into the dream. We enter back into the dream, which is a specialty of my work, because The nightmare is an inner post-traumatic stress disturbance. It is analogous to the post-traumatic stress disorders of the traumas that are met with in the everyday life, like the World Trade Center or the Newtown bombing, the Newtown murders. They're traumas. The internal trauma is a nightmare, and they usually represent a recurring theme of something in your life that has been with you throughout your life that you have not been able to master. So we go back and we have you become the master of the situation, and so that you can reframe the inner process, the inner nightmare experience, and turn it around to your benefit so that you become the one in charge rather than the one who becomes victimized by it. And doing that, you give a new possibility to your life because you've now seen things in a new way, and you've given a new direction to the way you're experiencing life, that the nightmare has had an effect of impeding some fulfillment in your life and has stopped you in some way and has brought with you certain anxieties and fears and worries into your everyday life experience in certain relationships in whatever way it may happen. We get to it very fast, and we go in and we turn it around through reversing and reworking the nightmare experience, that dream experience, because dreams are real.